seeing a lot of vertigo from BPPV this week, so I wanted to bring back a topic that I haven't discussed in a while, and that's how vestibular disorders may be interfering with your cognitive function. A really common complaint is when people have vertigo that their ability to think and their sharpness and their attention feels very cloudy and very foggy after they've had a vertigo episode and even shortly after they've received treatment for vertigo. Cover some of the highlights, but if you want to read a lot more detail about it, you could look up this paper and it'll go into a lot of the pathways and some of the things that we're talking about in depth. First and foremost, our vestibular organ is basically designed to tell us where our head is moving inside space. So it tells us if we're going forward, back, turning side to side, and which way gravity is pulling on us. Every time that your vestibular nerve fires, it's going to send a signal to the brainstem, which interacts with the cerebellum, and most importantly, it interacts with this guy, the hippocampus, which is basically where we form our memories, but is really the hub for a lot of our spatial orientation. Signals from this nerve goes into our brainstem and they go downward towards our spinal muscles, which helps us regulate our balance. But a lot of these signals are actually going to work their way to the thalamus, which is going to feed into multiple layers of the cerebral cortex. So our cerebral cortex is responsible for thinking and planning and basically giving us our higher level of thought processes. And there's more than 6 cortical regions that respond to movement of the head. This can all be affected when we have a dysfunctional vestibular system. But let's actually simplify things a little bit, and this is what I've explained to my patients. Your brain is organized like this. So the lowest areas of your brain are the brainstem, which is responsible for things that keep us alive. And it goes into the midbrain, which feed into appetite, satiety, arousal, and sleep. Then we have the limbic, which is the emotional areas. And then we have the higher levels, which is the cerebral cortex, which is abstract thought, concrete thought, planned movements, things like that. This pyramid represents the idea that if the needs of the lower part of the pyramid are not being met, then the things that sit on the top of the pyramid, like your cognition, are probably going to suffer as a result of that. Which makes sense with the idea that if you have tachycardia, if you can't breathe, you're having difficulty with blood glucose regulation, then none of the other stuff on top is really going to matter that much. When we talk about vestibular dysfunction, we lack the ability to determine where our head is in space, and when you can't determine where your head is in space, then the environment is going to feel very threatening to you. If the environment does not feel safe to you, then you are going to exist in a sympathetic fight or flight response, which means that you are in this midbrain limbic area where your brain is constantly perceiving threat. If your brain is just focused on threat and survival, then this area, that cortical area, is going to suffer as a result of that, meaning that until you get into a place where your brain feels safe in the space that you're in, then it does not matter whether you can think at a higher level or not. Which means that vestibular patients can suffer tremendously when they can't get their orientation right, but it also means that their cognition can come back nicely when we actually fix the problem.